First, we're going to have a real public education campaign to battle the skepticism. Just think of the math on this. You have to get to 75% to 85% of the overall population vaccinated for the vaccine to be effective, 75 to 85%. 50% of the population says right now they don't want to take the vaccine. They don't trust the approval process. They're worried about vaccines in general, but 50% are now saying they don't want to take the vaccine. You cannot get to 75% if 50% don't take it. Even I can do that math. So we're going to need a real public education to dispel the skepticism that already exists. Second, and very important to us here in the state of New York, this has to be done in a way that protects social justice. The healthcare system discriminates against Black, brown, and poor communities. By effect, you have fewer healthcare facilities in poorer communities. That is a fact. Higher death rate in these communities, higher infection rate in these communities, higher percentage of essential workers in these communities. So we want to make sure when we do the vaccine that it is done in a just and fair and equal way. And third, we want to expedite it. It's a massive undertaking. I think, frankly, people have not focused enough on the extent of what this undertaking means. I can't think of a government operation that has been commenced that is more difficult and intricate than what governments will be asked to do here. The scale of vaccinating every person in your state is just massive. New York has been very good at scaling up, and we've been very good at tackling challenges during COVID, like COVID testing. But this is going to test capacity all across the board. The way the vaccine is going to work is the federal government will be responsible for the procurement and the distribution. The military is doing the transportation. They're actually using private companies in part, FedEx, other private companies to distribute the vaccine to the different states. The federal government looks to the state to set the distribution locations. They will send it where we ask them to send it. And we then set the priorities for not only where it goes, but who gets it as the first set of priorities. Our priorities have basically tracked the federal government's suggestion on prioritization. The first shipment is allocated on the base of number of healthcare workers and nursing home residents in the state. The first allocation is for nursing home residents, nursing home staff, and high-risk healthcare workers. So that's how we're allocating what Buffalo gets versus Monroe versus Essex versus New York City. The state has set up 90 regional distribution centers that are capable of cold storage. This is a different definition of cold storage. This is like really, really cold storage. Not every facility can do it. Not every hospital can do it. But we've identified 90 regional centers that can keep the vaccine at the required temperature, and they'll act as distribution centers for that region. Pfizer's vaccine is expected to be approved by the FDA tomorrow. Immediately after that, our New York State panel will convene and review and approve it. They've already been speaking to the FDA about the process. I think the New York panel, as a second panel to approve, is going to go a long way towards battling that skepticism about the approval process, and we hope that it does. If the FDA approves, it's expected 6 million doses will be available nationwide. Half of those will ship immediately. The other half will be held for the second dose for those individuals who received the first dosage. Remember, everyone who gets this vaccine, you have to get 2 vaccines. So they'll ship now the number of vaccines to do the first vaccination. They will then ship 21 days later, the appropriate amount to vaccinate the people who received the first vaccination. New York expects the initial allocation of 170,000 doses. The federal government is doing the allocation based on state population. And again, they distribute it to the state. The state then turns around and does an allocation within places within the state. It could arrive as soon as this weekend. That assumes the FDA does act right away, the FDA does approve it, and the military turns around and ships it immediately, but it could actually be coming this weekend. Further allocations will be in the following weeks. Our state priority, nursing home residents first, nursing home staff. There was a discussion about, do you do the residents or do you do the staff? New York, we decided to do both, the residents and the nursing home staff. Then you go to high-risk hospital workers. We have about 700,000 hospital workers in this state, so it's a very large population. So we'll prioritize the high-risk hospital workers within that overall healthcare population. We have rules that we have established that we will send to hospitals about what is a quote-unquote high-risk healthcare worker. And then the hospitals will select the actual individuals who will get the first vaccines within that guidance. Emergency room workers, ICU staff, pulmonary department staff. The allocation by region. Again, this is based on number of nursing home residents, number of nursing home staff, and number of high-risk healthcare workers. The 90 locations across the state that can provide the cold storage will receive enough doses for roughly 90,000 patient-facing hospital staff. That is 40% of the total hospital patient-facing workforce of 225. The 225,000 is a subset of the overall 700,000, obviously. By the end of week 2, if all goes well and the federal government sticks to the schedule, we expect all high-risk staff will receive the vaccination. Staff at every hospital will have access to the allocation, even if their hospital doesn't have this cold storage capacity. They will have access to the vaccine by a hospital in their region that does have that storage capacity. After we take care of all the high-risk healthcare workers, we'll then move to all long-term and congregate care staff and residents, then EMS and other healthcare workers, and then essential workers, general population, starting with those who have the highest risk. The federal government offered a program that New York State opted into, whereby pharmacies will do the vaccinations in nursing homes, which will take a burden off the nursing home staff. And New York has opted into that program. It's run by the federal government, but basically they subcontract with private companies to do the vaccinations in nursing homes. Flu vaccine we do this way.